If you're a man over 40, I need you to hear me for the next few seconds, because most guys don't realize this until it's already happening. Your penile length can change with age, and not always in the direction you want. And no, it's not just in your head. There are real, measurable, scientifically documented reasons why some men notice they look shorter, feel shorter, or aren't performing the way they used to. And here's the part nobody likes talking about. A lot of men blame themselves. They think, maybe I'm just getting older, or worse, maybe this is the beginning of the end. But the truth is, there are actual medical, hormonal, and lifestyle factors that can either steal length from you or help you regain what you've lost. Most men don't know this. Most doctors don't even explain it. And you might be doing a few things right now, completely harmless-looking habits that are quietly sabotaging your size, your confidence, and your performance. So if you've ever looked down and thought, what the hell happened? Stay with me. You're about to understand what's really going on and, more importantly, what you can actually do about it, backed by real science. I'm Dr. Camila Hayes, men's health specialist here at the Diabetes Health Clinic, and for the last decade, I've helped thousands of men over 40 get their hormones back in balance, rebuild their energy, and feel confident again in the bedroom and in everyday life. Guys come to me stressed, embarrassed, frustrated, and I get it. You're not just dealing with aging, you're dealing with hormone shifts, circulation issues, metabolic changes, and the pressure of wanting to feel like yourself again. My whole mission is simple: to help men understand their bodies in a real, practical way, without the judgment, without the medical jargon, and without the nonsense you find online. I treat this stuff every single day. I've seen what works, I've seen what doesn't, and I'm here to give you the straight truth so you can make real improvements, safely and naturally. So if you're tired of guessing or wondering if something's wrong with you, relax. You're in the right place. Let's break this down together. All right, here's what we're going to cover today. I'm breaking this down into the most common scientifically backed reasons men lose length and the proven strategies that can actually help you maintain or even regain it. We're talking about circulation, hormones, scar tissue, hidden fat pad changes, pelvic floor tension, all the stuff most men never hear about, but absolutely should. I'm also going to walk you through what doesn't work, because there's a lot of garbage online that wastes your time, your money, and in some cases can actually make things worse. And stay with me till the end, because the last tip is something even a lot of urologists forget to mention. But it's one of the easiest, most effective changes men over 40 can make. By the time we're finished, you'll understand exactly what's happening inside your body, what's holding you back, and the steps that genuinely move the needle, no pun intended. So let's get into it. Before we get into the actual strategies, we need to talk about why this whole topic even matters, and why so many men over 40 suddenly notice changes they never saw coming. Because look, fellas, none of this happens overnight. It's not like you wake up one morning and boom. Things are different down there. It's slow, it's sneaky. And because it's gradual, most guys don't ask for help until they're already frustrated or worried. So let's break down what's really going on inside your body. First, circulation. Your penis is basically a hydraulic system. Blood in, blood staying in, pressure building, and everything working together. When you hit your 40s and especially your 50s, your blood vessels start to stiffen a bit. It's just physiology. Think of your arteries like flexible garden hoses. When they're young, they're soft, pliable, and open. With age, they lose elasticity, just like a hose that's been left in the sun too long. That means less blood flows easily, and if less blood fills the chambers, the erection doesn't stretch the tissue to its full potential. Translation? Things may not look as long or as full as they used to. Second, hormones. Testosterone isn't just about libido. It affects tissue integrity, blood flow, the way your body stores fat, and even how your pelvic floor muscles coordinate. When testosterone dips, and trust me, almost every man over 40 experiences some version of this, the penile tissue becomes less responsive. Some guys describe it like losing that youthful fullness. That's real. Lower testosterone means weaker erections, slower recovery, and yes, the appearance of reduced length even if nothing structurally changed. Then we've got the fat pad issue, and this one shocks a lot of men. Right above the base of the penis is a natural fat pad. When men gain weight with age, especially visceral fat from insulin resistance, slowing metabolism, stress hormones, or yes, diabetes, that fat pushes outward and literally swallows part of the penile shaft. Your actual length might be the same, but what's visible becomes less. Guys come into my clinic saying, "Doc, I swear I'm shrinking." And sometimes the penis didn't shrink at all. It just got buried by changes in body composition. Next up, microscar tissue and reduced elasticity. As you age, and especially if you're dealing with chronic inflammation, high blood sugar, or poor circulation, the collagen in the penile tissue stiffens. Think of it like a rubber band that's been stretched too many times. It loses some bounce. If the tissue doesn't stretch fully during erections, the penis doesn't reach its maximum potential length. Over time, that lack of full expansion can actually lead to real shortening. Another huge factor men don't realize is pelvic floor tension. If those muscles get overly tight from stress, sitting all day, or poor posture, they can literally pull the penis inward. Most guys think pelvic floor issues are only about weak muscles, but overly tight muscles are just as common, especially in high-achieving men who carry a lot of stress in their hips and lower abdomen. Imagine a drawstring being pulled. Everything gets pulled in slightly. Then there's aging itself, but not in the doom and gloom way most men picture. Aging doesn't destroy your sexual function. It just shifts the way your system responds. Blood vessel health changes. Hormones change. The nervous system becomes slightly less responsive. The tissues need more stimulation, more oxygen, more stretching. You're not broken. Your body simply needs different kinds of support than it did at 25. And honestly, here's the part that frustrates me as a doctor. Most men blame themselves. They think they're doing something wrong. They think it's too late. They think there's nothing they can do. But that's not reality. The truth is that most of these changes are reversible, or at least manageable, when you understand what's driving them. Do you know what else most men get wrong? They chase the wrong solutions. They look for miracle pills, weird devices, or trends they see online. Meanwhile, they ignore the foundational, scientifically proven things that actually influence size, blood flow, hormones, tissue elasticity, inflammation, pelvic floor balance, and metabolic health. That's why this conversation matters. Because when you understand the physiology, when you see what's actually happening inside your body, you realize you're not powerless. You're not declining. You're not past your prime. You're simply dealing with changes that can be optimized if you know what to do. And that's exactly what we're going to walk through next. The real medically supported steps that genuinely help men improve length, restore function, and feel like themselves again. Let's get into it. First, fixing blood flow. The number one factor men overlook. All right, fellas, let's start with the big one. Circulation. Your penis is a pressure system. When blood rushes in and stays in, the tissue expands to full capacity, and that's what gives you your maximum length. But as you hit your 40s, the blood vessels stiffen, narrow, or get inflamed, especially if you've got diabetes, high blood pressure, high cholesterol, or even just years of stress. Think of your blood vessels like garden hoses. When they're new, water flows easily. With age, they stiffen, kink, and narrow. So even if you feel like you're getting an erection, you may not be filling the tissue all the way. That incomplete expansion can make you look shorter. What do most men do wrong? They go straight for pills, which are fine, but they don't fix the underlying issue. What actually works? Improve nitric oxide naturally. Beetroot, leafy greens, L-citrulline. Move your body daily. Walking boosts penile blood flow more than you'd think. Cut back on smoking and heavy drinking. Strengthen cardio health. Your penis is literally a diagnostic tool for your heart. You fix blood flow, you fix a lot. Second, restoring testosterone and hormonal balance. Hormones are the silent engine behind everything down there. When testosterone dips, which it does for almost every man over 40, you lose tissue responsiveness, nerve sensitivity, and the ability to get those strong, full, stretched erections that maintain length. Inside your body, testosterone keeps penile tissue elastic and healthy. Without it, erections become softer, shorter, or inconsistent. What men get wrong? They assume libido is the only sign. Nope. Low T can show up first as weaker erections, smaller morning wood, reduced fullness, and a loss of hang. What actually works? Improve sleep. Your best testosterone is made at night. Reduce belly fat. Abdominal fat steals testosterone. Resistance training, especially legs and glutes, boosts levels naturally. Check your levels with a real doctor, not a cheap online test. If medically appropriate, supervised TRT or HCG protocols can change everything. Hormonal balance doesn't just improve function, it restores physical structure. Third, reducing the suprapubic fat pad, hidden length. This one shocks guys every time. You don't just lose length, sometimes it's hiding. That fat pad right above the base of the penis, when it thickens, it literally swallows part of your shaft. Men with diabetes or insulin resistance see this even faster because the body tends to store fat in the lower abdomen. Picture it this way, it's like burying a fence post in sand. The more sand you pile up, the less of the post you see. What men get wrong, they think they need a device or supplement when the real issue is body composition. What works? Lose 10 to 20 pounds of belly fat. Many men gain back half to 1 full inch of visible length. Improve insulin sensitivity, fewer blood sugar spikes, less lower ab fat. Reduce inflammation, better diet, less processed carbs. Consider ultrasound fat therapy or targeted treatments if needed. This is one of the fastest, most natural ways to see a difference. Fourth, breaking up microscar tissue and improving elasticity. Over time, especially with poor blood flow or high blood sugar, collagen inside the penis stiffens. That stiffness prevents the tissue from fully expanding. Sometimes it's subtle, but it can absolutely reduce length. Inside your body, this feels like the difference between stretching a soft rubber band versus a dried, brittle one. The brittle one doesn't expand fully. What men get wrong, they assume this only happens with Peyronie's disease. Nope. Microscarring can happen to almost anyone over 40. What works? Regular, full erections, sexual or non-sexual, help keep tissue stretched. Vacuum therapy, medically approved pumps, not gimmicks, improves elasticity. Good glycemic control prevents stiff collagen. Vitamin E and antioxidant foods support soft tissue health. Shockwave therapy in qualified clinics breaks up microscar tissue safely. No magic tricks, just science applied consistently. Fifth, correcting pelvic floor tension. The secret, inward pull. Most men think pelvic floor problems mean weakness, but honestly, for stressed, sitting all day men, the problem is often tightness. Muscles clenched 24/7 like a fist. Tight pelvic floor muscles can literally pull the penis inward, making it look shorter or causing it to retract when cold or stressed. Think of it like tightening a drawstring. Everything pulls inward. What men get wrong, they do endless Kegels, which can actually make the problem worse. What works? Deep hip and pelvic floor stretching, relaxation breathing, especially belly breathing, sitting less, standing more. Seeing a pelvic floor therapist trained in men's health, avoiding overcontracting during workouts. When that tension releases, the hang improves and inward pull reduces. Sixth, improving nerve health for better stimulation. Your nerves carry signals that allow erections to form fully and quickly. As men age, especially with diabetes, nerve sensitivity decreases. That means weaker erections and less tissue expansion. Think of nerves like electrical wires. If the wiring is worn out, the current doesn't get through efficiently. What men get wrong, they blame their mind. Maybe I'm not attracted enough, or maybe it's stress. But physiologically, weaker nerve conduction equals weaker erections. What works? Improve blood sugar control. Diabetes is the #1 cause of nerve decline. Alpha-lipoic acid and B-complex vitamins support nerve repair. Regular sexual stimulation. Nerves activate and stay healthier with use. Reduce alcohol, which blocks nerve signals. Healthy nerves equals better erections equals better length retention. Seventh, regular stretching through strong erections. Here's a simple, underrated truth. Your penis is an organ that stays healthy by being used. Regular erections deliver oxygen, stretch tissue, and preserve the elasticity needed for full length. When men go long periods without erections, whether due to stress, depression, low T, or health issues, the tissue slowly adapts to not being fully stretched. Imagine not stretching your hamstrings for a year. They shorten. Same concept. What men get wrong. They think desire has to come first. Actually, stimulation can create desire. The body responds to activity. What works? More frequent sexual or non-sexual stimulation. Nighttime erections count. Improving sleep helps these increase. Use it or lose it applies here more than almost anywhere else in the body. If needed, medically guided PDE5 inhibitors like sildenafil can maintain healthy erections, not just performance. Strong erections equals tissue expansion equals preserved length. Let me tell you about a patient of mine. We'll call him Michael. He's 54, works a desk job in IT, married for over 20 years, 2 kids, great sense of humor. But when he first came to see me, he walked into my office looking absolutely defeated. He sat down and said, "Dr. Hayes, I swear something's happening down there. I'm not imagining it. I look shorter. I feel shorter, and I'm embarrassed even saying this out loud." And immediately I could see the stress in his shoulders, not just sexual frustration, but that deeper fear men carry when they feel like their masculinity is slipping away. I hear that all the time, by the way. You are not alone if you've felt that. So I asked him a few questions. How long had he felt this way? What was happening with his energy? Any changes in weight, stress, sleep, blood sugar? And little by little, the picture started forming. Michael had gained about 25 pounds over the last couple of years, most of it around his belly. His A1C had crept into the pre-diabetic range. He wasn't moving his body much. He told me he would sit 8 to 10 hours a day. And he admitted something that a lot of men hesitate to say out loud. His erections just weren't as strong as they used to be. Morning wood was rare, sex took more effort, and he said, "It's like my body isn't giving 100% anymore." When I examined him, everything lined up perfectly with what we just talked about today. His suprapubic fat pad had thickened, hiding almost an inch of visible length. His pelvic floor was tight as a drum from years of sitting and stress. His testosterone was on the low end of normal, which for most men is still too low to feel great. And because his erections weren't filling the tissue fully anymore, the shaft wasn't getting that regular stretch it needed. So we made a plan, nothing extreme, no gimmicks, no weird devices. We focused on the big levers, improving blood sugar control, dropping that belly fat, restoring healthy testosterone levels, increasing blood flow, releasing pelvic floor tension, getting back regular, strong erections to stretch the tissue again. Within 3 months, he'd lost 14 pounds. And remember, most of that came off the lower abdomen first. His visible length improved noticeably. His wife even joked, "Everything looks longer these days," which he told me with the biggest grin on his face. His morning erections came back. His confidence improved, his full erections looked stronger, and that alone gave him back almost half an inch of functional length because the tissue was fully expanding again. But the best part wasn't the physical change, it was the shift in how he saw himself. He looked at me during his follow-up and said, "I thought this was just aging. I thought I had to accept it. I didn't realize my body could bounce back." And that's the lesson I want every man watching this to understand. Your body isn't done. Your performance isn't done. Your confidence isn't done. You just need to understand what's happening and give your body the right support. Most men are 1 or 2 smart changes away from feeling like themselves again, sometimes even better than before. And if Michael can do it at 54, you can absolutely do it too. All right, let's clear up a few huge myths that absolutely refuse to die. And honestly, these myths cause more harm than good. Most men hear these things online, from buddies, or even from doctors who don't specialize in men's sexual health. So let's break them down one by one. Myth number 1. You can't change penile length. It's all genetics. Okay, yes, genetics determine your baseline, but saying you can't influence length at all? Completely false. Here's why this myth exists. Medical training traditionally teaches that the penis has a fixed size once you're an adult. That's technically true for bone structure, but your penis isn't bone, it's tissue, and soft tissue changes based on blood flow, hormones, inflammation, elasticity, and lifestyle. What's the truth? You can lose length over time, and you can regain some of it by restoring those factors. Guys over 40 commonly lose anywhere from 1/4 to 1 full inch of functional or visible length due to things like fat pad growth, weaker erections, or micro scar tissue. Fixing those can absolutely bring that length back. Not magic, biology. Myth number 2. More Kegels will fix everything down there. This one is everywhere, and I'm telling you, it is misleading for men. Why it exists. Kegels became a huge trend because they help women after childbirth, so someone figured, hey, must help men too. But here's the reality. Most men, especially men in their 40s, 50s, and 60s, don't have weak pelvic floors. They have tight pelvic floors, and doing tons of Kegels on a tight pelvic floor is like tightening an already tight fist. It pulls the penis inward, messes with erections, and can actually make length appear shorter. The truth, you probably need pelvic floor relaxation, not contraction. Stretching, breathing, mobility, those are the things that usually help men the most. Myth number 3, pump devices, pills, or supplements will give you permanent gains. Look, I know the ads look convincing. I know some devices have legitimate clinical uses, and I know the supplement industry is a billion-dollar machine. But here's why this myth is so sticky. Guys want a quick solution. Something simple. Something that doesn't require them to change anything else. But the truth is this, most pumps online are either unsafe or ineffective. Most pills do not increase size, and anything claiming permanent gains without lifestyle improvements is either lying or selling snake oil. What does work? Medically approved vacuum therapy used consistently, nitric oxide supporting supplements for blood flow, hormone balance, erections that fully expand the tissue, reducing the fat pad, fixing circulation. These give real results because they're addressing the root causes, not pretending to bypass biology. Myth number 4, if things are shrinking, it's just aging, nothing you can do. This one breaks my heart because it's the myth that keeps men suffering silently. Why it exists. Most guys assume that anything changing after 40 is just part of getting older, but that mindset stops you from fixing things that are absolutely fixable. The truth, aging is a factor, sure, but it's not the cause. The causes are things like reduced blood flow, low testosterone, weight gain, poor nerve health, tissue stiffness, inflammation, pelvic floor dysfunction. None of those are destiny. All of those are modifiable. Aging isn't the problem. Neglect is the problem. And the body responds incredibly well when you give it the right inputs again. Bottom line, don't let myths make you feel hopeless, embarrassed, or too old. The science is clear. Men can preserve and even improve penile length, function, and confidence well into their 50s, 60s, and beyond, when they focus on the real drivers, not the internet noise. Let's keep going. All right, guys, let's boil this down so it sticks. Here's what we covered today. Blood flow is king. Keep your vessels healthy, move your body, eat nitric oxide boosting foods. Hormones matter. Testosterone isn't just about libido. It keeps tissue healthy and full. The fat pad hides length. Losing belly fat can literally make you look longer. Elasticity counts. Micro scar tissue and stiff collagen need attention. Pelvic floor tension. Relax. Don't overcontract. Stretch and breathe. Nerve health. Keep nerves healthy with good blood sugar, vitamins, and regular stimulation. Regular, strong erections. They keep tissue stretched, oxygenated, and functional. And remember the myths we busted. Genetics, Kegels, miracle pills, and just aging aren't the whole story. Real changes come from real science-backed actions. These are the steps that actually make a difference. Not hype, not gimmicks, but practical strategies men over 40 can use today. All right, fellas, if you're serious about taking control of your sexual health, confidence, and yes, even your penile length? Here's what I want you to do next. First, hit that like button so more men like you can see this. Second, subscribe to the channel. I post practical, science-backed men's health tips every week. And here's the best part. I've put together a free guide for men over 40 that walks you through every step we just talked about, from blood flow hacks to hormone optimization, pelvic floor exercises, and more. The link's right in the description below. Grab it, read it, and start applying it today. Also, I want to hear from you. Drop a comment and tell me, which one of these areas do you struggle with the most? Blood flow, hormones, fat pad, or something else? I read every single one, and I love giving personalized guidance. You don't have to figure this out alone. Take action today. Your body, your confidence, and your future self will thank you. Remember, you're not alone in this, and you're definitely not broken. Men over 40 face changes. It's normal. But that doesn't mean you have to accept them. With the right guidance, the right strategies, and a little consistency, your body can respond, your confidence can return, and you can feel like yourself again. I'm Dr. Camila Hayes. Stay strong, stay healthy, and I'll see you in the next video. If you want, I can now compile the full 20 to 25-minute YouTube script from all the sections we've written so it's ready to use on camera. Do you want me to do that next?